you a woman in medicine feeling overwhelmed and disconnected from the personal fulfillment that you desire? You're in the right place. Join Doctors Joanne and Aaron as they rewrite the rules for women in medicine. Let's begin.
We have another surprise guest for you all, Dr.Nancy Yen Shipley, and she's an orthopedic surgeon. And we will be talking about different paths into medicine, the importance of having a holistic approach while practicing medicine, as well as menopause. If you have not noticed, we have been doing a series on women's health and menopause. So we will be talking more about that. So let's dive in. Nancy, tell us about your unique path into medicine.
Well, first of all, thank you so much for having me on your podcast. I'm honored to be here. I had a really non-traditional route into medicine. I was at UCLA as an undergrad, and of course, like all good, I'll say all good Chinese American kids, we go into college with our parental pressures and thinking that we're going to go into medicine. And I think at that time I wasn't ready. I didn't think I was doing it for the right reasons. I entered as a pre-med and I was very rapidly weeded out. And when I graduated from college, I did not have the best GPA. I like to tell people I had a 2.99999. So that rounds up to a 3.0, but definitely not good enough for medical school. I went on a little bit of a circuitous path and I worked in the snowboarding industry. I was just trying to find myself. And it wasn't until I had some exposure to actually acupuncture and Chinese medicine in working with my stepdad in his business that I realized I went full circle and I said, I actually am really fascinated at how we can heal people and get people better. And I want to go to medical school. And so I was working full time. I took a full 6 years off after college and I was getting all of my post-bacs done because it had been too long. My old biology classes had expired. And so I did all of that, took the MCAT, got into medical school and started at around the age of 29. So it was definitely a little bit of a different path into medicine.
Wow. I had no idea, Nancy. I love hearing about that path because Joanne and I are always highlighting how people either enter medicine differently or also are taking different paths within medicine. So intriguing. And I love that you got into snowboarding. I wonder if that's how you ended up in orthopedic surgery. And maybe that's something that you can highlight. How did you also specifically get into orthopedics, which is obviously not that common for women in medicine?
Yeah, it's funny because of my pre-medicine background in learning a little bit about acupuncture and how Chinese medicine can be integrated, I was thinking, okay, it seems to make sense for me to be an internist or maybe go into family medicine. And I went into medical school thinking that. And once I got into a little bit further into school and into my clinical rotations, it became very clear. And I'm sure you both remember as you started med school, there was a divide, right? There were the people who were moving more into specialties where they would be using their hands, right? So the surgical procedural types, and then everybody else who was more non-procedural. And I very quickly found out that was my path and that I probably needed to look at something where I was using my hands. So I decided probably sometime around late second year, as I was getting ready to go into my clinical rotations, that I would go into more of a surgical field. I had actually between my first and second years a really pivotal moment where I had the chance, just not because I chose, but because there was a family friend who was an orthopedic surgeon. So on our summer break, I went and shadowed for a full 2 weeks, which was a pretty good chunk of time because I actually got to see a patient come in for pre-op, have a surgery. This surgeon was a joint replacement surgeon. And so I got to watch a total hip and a total knee replacement And then I got to see them at the post-op visit, and I was blown away that you could do this maximally invasive surgery. I mean, the person's filleted open, right? And have their hip replaced, and then actually be walking into the office just days later. I was really blown away by how maximally invasive those surgeries are, but yet the resilience of the human body in that we can recover the way that we do. And so that really piqued my interest in orthopedics. I then had great rotations in my third year, and great mentors at the time, and it just clicked. I think just thinking about our joints in a mechanical perspective and how to restore that function just really clicked for me in my head. And so at that point, I decided I was going to do orthopedics. No one could talk me out of it. I had no idea. I was pretty oblivious initially to the fact that there weren't a lot of women. I just said, well, this is what I want to do, and so I'm going to do it. And it was interesting. And fortunately, I let a lot of things roll off my back when people would make comments, and it was almost always people outside of orthopedics. They would make comments like, well, women don't do orthopedics, girls can't do orthopedics, you're not tall enough, you're not strong enough, you're not a jock, you're never going to be able to find a husband. And I would say, let's hope that that husband finds me, because that's not why I'm here in medical school. There was a lot of running commentary on why I shouldn't do it. And if anything, that just fueled me more because I had my mind made up and I knew what I wanted to do. So I pursued it.
And I wonder how that 6-year gap and not being the traditional medical student helped you be even more successful as a woman in orthopedic surgery when that wasn't normal either.
I think it was actually hugely helpful because during that time, so as I mentioned, I worked in the snowboarding industry, also at the time, very male dominated. I mean, the sales reps and the marketing people, it was a lot of guys. But I loved to snowboard at the time, and I actually didn't really know what I wanted to do with my life. So I was like, well, I'll try this on for a little bit. I think it was really helpful because in my time, I got to learn to be able to relate to lots of different individuals of different ages and backgrounds. And my time working with my stepdad when I helped him with his business, in which we traveled around and taught seminars. And so there was a lot of interfacing with people who were a lot older than me. And being in that role helped me tremendously when I entered my third year rotations. I think I saw a lot of my peers who had come straight out of college without a lot of real world experience struggle a little bit in that transition. Because oftentimes you finish school and you're used to communicating and being around your peer group and people of the same age, and you may not necessarily have that exposure to people who are 50, 60, 70, 80 years old. And I felt like that was a really easy transition for me, whereas it took my peers a little bit longer to get there and to reach that level of comfort.
I am always so impressed with women surgeons. As a psychiatrist, that I just sit and talk with my patients and I hear you all what you do and the environment. I'm like, yes, like it's like this superpower that comes. I remember my medical school class many, many years ago. It was the first class that had more females than men. So we were already like, yes, we rock it. And actually there were literally a few of my classmates that went into ortho, and I felt so proud for them. I still cheer them on, and but it's interesting. I love hearing your passion for it too, because my kid who's in college, he wants to go into medicine. And he wants to be an orthopedic surgeon. And then my mom brain goes like, oh my goodness, is that like a good field for him? And, would it be too much? And of course, this is my mom worry. He's going to do great, whatever he chooses. So it's inspiring me too, and giving me hope of, just hearing your passion. Thank you so much for sharing. And for sharing, I love like Erin was pointing out, that sometimes taking a different path from the beginning, that we go in thinking, oh, am I too late? Am I too old? And actually, it can give you an edge. It can give you, whether you knew it or not, maybe gave you that maturity, that confidence, that courage to be like, of course I can. Why not? I love it how you said it. This is what I like. I'm going to figure it out. So what a beautiful message. We can apply that to so many other things in our lives.
Thank you.
And I hear you talking about your stepdad, who was an acupuncturist, and then you worked in snowboarding, and then mentored by this orthopedic surgeon. And I know that you also do integrative regenerative medicine. And I would love to hear how you weave that in to your orthopedic practice.
So I would definitely say that I am a surgeon through and through. However, in the past years, I have come to realize that it's not a complete picture of how we can best take care of our patients' musculoskeletal health. I feel that there is this entire developing world of regenerative medicine that I have integrated into my practice that has really enriched what I'm able to do for my patients. I am, I would consider myself a conservative surgeon. Obviously, when individuals come in, if there is a bone broken in half, if the joint's destroyed, if there is an obvious rotator cuff tear with weakness, then those are pretty clear indications for surgery. But I love how we can use biologics to supplement even surgical cases, right? And so let's take rotator cuff tears as an example, especially in individuals in midlife. There certainly is a traumatic component of it, but there is truly a biologic component for why that tendon failed, right? And so what we're seeing in midlife is that individuals will have these progressive degenerative changes in their rotator cuff, and then you combine that with overuse, whether it's tennis or occupational, and then there you get a weakness in the tendon and ultimately rupture. With that said, not all rotator cuff tendons need to be repaired. However, there are clear indications for surgery. And what I often do in those cases is I will supplement with something like platelet-rich plasma, because I explain to my patients that, there is a mechanical issue here, right? Your muscle is no longer connected to the bone. It's not able to lift your arm. That's why you have weakness. But we also have to look at the biologic reasons for why your tendon failed. We can sew it together, but in almost all cases where people have failed rotator cuff repairs, it's not because our anchor pulled out or the suture broke. It's because the tendon just slips out of its repair because it's not robust. It's like trying to sew cotton balls when the tendon's really degenerated. So that's where I use regenerative medicine in the instance in which we're still proceeding to surgery. But one of the other areas where I'll use things like PRP, MFAT, which is microadipose treatment utilizing our own stem cells for regenerative purposes, is also in the non-surgical realm. I will have people with early arthritic changes, inflammation in their joints. We talked a little bit about menopause, which I'm sure we'll talk more on, in which there are not significant structural changes, but our joints are inflamed. I think that's another great indication for utilization of something like platelet-rich plasma to help decrease the inflammation in the joint, to change the environment inside that joint so it's less inflamed, so that people can function better. So there are so many different applications that I'm really excited about.
Wow. I am so impressed listening to you. I'm like, oh my goodness, she's so smart. So much information. And also breaking the myth, right? Like if you break something, you'll go to the, orthopedic surgeon and they're just going to open you up and, fix it and then buy, and love hearing you explain. There's a lot more. This, like you said, this holistic approach to taking care of the patients. And I don't like, as a patient having had knee surgery, it's also very hopeful to know, like, okay, there's different ways that I can protect my ligaments and be strong. And I'm sure that your patients feel very safe with when you explain it like that, because I know that that's maybe the fear I hear in my practice with my psychiatry patients, that they come in telling me about how anxious they are about their surgery, or or they're so afraid they cancel it. And I imagine that it just hearing you coming across like this to your patients, how fortunate are they to have this approach? This is so interesting and important. Thank you.
Thank you. Thank you. I will have patients come to me and say, well, I waited a really long time to come see you because I was afraid that if I went to a surgeon, I would have to have surgery. And I think it's a little bit of a misnomer, saying, oh, I'm going to go see the orthopedic surgeon, because really we are the ones that provide full spectrum musculoskeletal care, from everything from the conservative to the maximally invasive. And so I do think that patients are reassured when they find out that coming to see me doesn't necessarily mean that they have to have surgery. And in fact, I spend a lot of time talking people out of surgery, because I'm like, well, you may have been sent here because you have a small rotator cuff tear, but here are other options. And patients do appreciate that.
Yeah, thank you for breaking those myths and reassuring the patients. It's so important. And this is perfect for my next question that I have for you, because what are some kind of unique issues that midlife women deal with, and when it comes to what we're talking about today?
Well, I have to give some props to my colleagues. So Jocelyn Wittstein and Vonda Wright are both orthopedic surgeons, and just last year they released a paper delineating the nomenclature musculoskeletal syndrome of menopause, and I think everyone should read it. This is great for people in healthcare or even lay people, just to read that a lot of these symptoms that we experience in midlife, with aching joints, frozen shoulder, stiff joints, are not in our head. And I think that's important to say, because one of the things that the paper talks about is that something around 40% of these joint issues that midlife women present with in the perimenopausal stage end up being structurally negative on MRI and X-ray. So you could have a stone cold X-ray, stone cold MRI, but yet you feel like you're falling apart. And so I think it's really important that a name was given to these cluster of symptoms, because otherwise, women are brushed off oftentimes, as more so than men, when they go to see a physician with a complaint. And then you imagine you come in and you're like, my knees are killing me. I can't go up and down stairs. I can't play tennis. Something's wrong with me. And then to have these negative studies, to have a name for this cluster of symptoms is very validating for the patients, but it's also really good for people providing healthcare to be able to recognize this. And I'm really glad that menopause is just on the tip of everyone's tongues now, because it's also really opening everyone's eyes to the musculoskeletal component of it as well.
I love that you're really highlighting some of those issues that affect many of our listeners who may be perimenopausal or menopausal, or they may be women in medicine who are treating patients in those ages. And as our listener may know, we have interviewed 3 other physicians who are involved in this Portland Menopause Collective. Dr. Aoife O'Sullivan, we interviewed in episode 66. If you haven't yet listened to that, highly recommend it. Another physician, Dr. Andrea Matsumura, was in episode 72, talking about all things sleep related to menopause. And in episode number 76, Dr. Leslie Sanchez Gottler was interviewed about obesity medicine and weight issues that can be specific for women in menopause. And we'll put links in the show notes to all of those. And I would love to hear from you, Nancy, about how did you get involved in this Portland Menopause Collective?
Well, I had known several of these women just through our local community, and they had approached me to kind of give my 2 cents on the musculoskeletal aspect of things for a documentary screening of the M Factor that we held a couple of months ago, where we did a Q&A afterwards on perimenopausal topics. And so that's how the Portland Menopause Collective came to be. We're just like-minded individuals, but from varied specialties who had a passion for improving care for our midlife women patients, and each from our own perspectives and our own respective specialties. And so out of that came the collective and the idea to host a conference here in Portland, one of the first of its kind. It's coming up. I believe by the time this episode comes out, it will still have not yet happened. And so there should still be availability to join us. It's on Saturday, March 15th. But we will be talking about all things perimenopause. I will be talking about bone and joint health, the musculoskeletal syndrome of menopause, frozen shoulder. What can we do about these things? And so I'll kind of do our bone and joint hodgepodge talk at the time. And all four of us will be speaking on our respective topics. So we're really excited to be presenting this to Portland. It's open to the general public, but we welcome our colleagues in medicine. There's continuing education offered for those individuals as well. So it's going to be a great time. Great morning.
I'm so excited. I'm just an hour south of you in Salem, and I will be headed up there to see the conference myself and bringing along as many of the other individuals that are so excited about the idea of this conference. Can't wait. And it'll be 2 days after the release of this issue. So there's still time to sign up.
Yes. Wonderful.
I'm so excited for you all. And it's, like you said, getting like-minded individuals and we can think differently, and then how beautiful to say, why don't we put in the effort, because it matters, because this is information that needs to be out there as physicians to provide for our patients, and then also for ourselves, because again, some of us are in that stage of our lives too. So I'm also individually interested in all these topics. I know I get asked so many questions about menopause, and again, as a psychiatrist, it has been important to me to understand when, this time midlife, when some of my patients all of a sudden feel like they're getting depressed again, or the depression looks a little bit different now. They're more irritable and having more sleep problems. And that's a question that I'm, got used to asking, like, where are you in your menstrual period life? Have you checked in with your primary? Have you checked in with your OB-GYN, and kind of encourage them to really go there and maybe demystify, which is one of the things that we talked about with Aoife, of hormone replacement and so much of the new information that we have it's one more thing that we've been scared about. So we've learned so much in this series and talking about the different aspects of menopause. So I'm very appreciative. So I have another question for you. As you know, our podcast is called Create Meaning in Medicine, Rewriting the Rules for Women Physicians. And we would love to hear, how are you rewriting the rules?
Well, I love that question. I feel like my entire path has been a repeat of rewriting the rules every step of the way. Just going from thinking, am I too old to go back to school? Am I too old to go to medical school? Am I too female to pursue orthopedics? It's been a lifetime of rewriting rules, but I would say more relevant for now. I think one of the ways I'm rewriting the rules is just what we were talking about. I think a lot of my patients are pretty surprised when the women come in midlife. They've got shoulder pain, they've got a frozen shoulder, and I say, hold on, let's pause. Where are you in your hormonal pathway here? Have you stopped your periods? And I think to have an orthopedic surgeon actually say that to a woman patient, it blows them away. And they pause for a second. They go, oh my gosh, I think I started having some hot flashes, and I'm having this and I'm having that. And I link that back into the musculoskeletal conversation. The patients definitely are surprised, but then they appreciate it. And so I think that's one way to rewrite the rules. I will say more on the work-life balance piece of it. I think rewriting the rules in terms of prioritizing not just our patients and our career, but also knowing that a happy physician and a happy woman physician at home is going to help me take better care of my patients, right? And so what that means to me is making sure I take care of myself and that I prioritize my health and my well-being and also my time with my family, which is very, very important to me. As you know, I just came back from a 2-week trip. I took time off and traveled to Japan with my family, and it was wonderful. And just 1 year ago, I was 13 years into practice already, was the first time I ever took 2 weeks off. And I realized that when I came back, my practice was still there. Things hadn't burned down. Everything was okay. I have wonderful partners that covered for me while I was gone. And so that is one way we need to rewrite the rules, is that we have to prioritize ourselves. We have to prioritize what is important to each of us. And for me, that's my family. And we can still be amazing, wonderful physicians even if we do that, and we will be better physicians if we do that. So that's what I would add to that.
We love frameworks in this podcast, and you just gave us this beautiful framework. And I don't know, again, in my bias, that coming from an orthopedic surgeon, right? Checking in terms of hormones for your patients. And then thank you for showing us possibilities of how we've been trained to think a certain way as doctors, and to say, guess what? Yes, you can take a 2-week vacation. And yes, please prioritize yourself and what's really important, and that's your family. And I loved how you said a happier physician will be better, right? Like I'm paraphrasing badly, you said it so beautifully. And what a beautiful framework for us of what's possible, and that yes, we can, and that it can sometimes take a reframe in our thinking and our approach to rewrite the rules for our lives and to feel more balanced and fulfilled. Thank you for that.
And I just want to highlight some of the lessons I've learned. I've been taking notes like mad here. You've really shared this non-traditional path to medicine and how successful that was for you. And I find that so inspiring for not just the other women in medicine, but maybe, as Joanne was saying, their children who might be looking into medical careers and recognizing it's never too late. You shared some really powerful mentoring and life experiences with your stepdad in acupuncture, and also this orthopedic surgeon who mentored you and allowed you to experience and see a side of orthopedic surgery that you may not have experienced otherwise. And so powerful as we look at finding experiences for ourselves or those that might want to go into medicine. You shared a depth of information about menopause. And again, as we highlighted, we've interviewed several specialists on menopause, and you will find each of those episode links in the show notes. I've learned so much from each of you experts. And then that I'm going to highlight again what Joanne said, that a happy woman physician at home is going to take better care of your patients. That just hits home for me, and I'm sure our listener as well. I know I'm so intrigued, and I can't wait to learn more from you at this menopause conference. Tell us the name of the conference, where they can find information about it, and where our listener can find you as well, Dr. Nancy.
So the Portland Menopause Collective is holding this conference, and it is called Hot Flashes and Cool Solutions. We love it. It's a little cheeky, and we will be holding it at the Portland Sheraton near the airport. It'll be Saturday, March 15th. We will start registration at 8 in the morning. We should wrap up around 12:30. You get meals, you get good talks, you get good camaraderie, and also some really great goodie bags. So the Portland Menopause Collective is on Instagram at PDX Menopause Collective. And I am also on social media as _Nancy MD. My website is nancymd.com. I practice at Multnomah Orthopedic Clinic here in Portland, Oregon. And we are also online as multnomahortho.com.
I love that. I know that I will be looking up information and sharing it widely. And with that, we hope you have enjoyed this series about menopause. It's not over yet. Stay tuned for our next episode when we highlight Kirsten Smith, a physical therapist who helps us address issues with pelvic floor issues, something not always talked about, but very important for many women in menopause. Stay tuned for our next episode.
Do you want exclusive resources and the opportunity to connect with us? Then visit createmeaninginmedicine.com now, where you'll dive deeper into how you can create meaning in medicine. And if you're serious about optimizing your results, take 2 quick steps now. Connect with us on the website and tune in to the next episode.